Angiogram is when a nurse comes to your room and says, "I'm going to shave you now." Welcome back. In the last video, I ended when I was being admitted to a cardiac ward, in my case, like a cardiac hospital. So I thought I would share with you some of the things that you hear when you're admitted that you have no idea what they're talking about. Something like, and this is even told, some of it you just see. So on the board in my hospital room, I was going to say my bedroom, but my hospital room, it had the name of the doctor, the name of the nurse, and then it said NSTEMI. So what is that? And the full sentence would probably be, your ECG indicates you've had an NSTEMI, and your echo seems to indicate you've had a Takotsubo. But don't worry, we're going to send you to the Cath lab to see what's going on. Shall I say that in English? NSTEMI is the opposite of STEMI, and if you're ever in the hospital emergency room, you might hear over the speaker, STEMI, code STEMI, is a serious heart attack where there's been a full blockage of an artery, usually by a blood clot. NSTEMI is there could have been a less severe or a severe blockage of an artery, but not a complete one. So the artery was still getting some blood through. Yeah, so that's the difference between a STEMI and an NSTEMI. It's called that because on the ECG, the electrocardiogram, that's the thing with the squiggly lines, the waves of the ECG are lettered. So you have a QRST. So the QRS is usually the point, and the first part of it, and then the last point. And ST are the two waves that follow the downward slope. So if the ST doesn't go down but goes up, that's an ST elevation. And if it doesn't do that, that's a non-ST elevation. And sometimes also in a non-ST elevation, there'll be an inverted T wave. So instead of the T wave going up, it's going to go down. So that's an NSTEMI. It can still be serious, but it's not a full blockage. So echocardiogram is an ultrasound of your heart. So they look at your heart while it's beating, they take snapshots of it so they can actually see, is there any damage to the heart? A more beautiful way of saying it is an echocardiogram uses safe sound waves to create live moving pictures of your heart. So it shows how well your heart muscle pumps blood, checks the size and shape of your heart chambers, and evaluates how your heart valves open and close. One of the things it looks at is ejection fraction, which is the amount of blood left after the heart is pumped, I believe. Something like that. They measure how much blood is left that hasn't been pumped through, or vice versa. But it has to do with the amount of blood left in a ventricle or in an area. Now, to properly explain ejection fraction, I was right, I just didn't know what part was what. So ejection fraction is the percentage of blood pumped out of the heart's main pumping chamber, which is the left ventricle, with each heartbeat. So with each heartbeat, they want to know how much of the blood has been pumped through. So an ejection fraction of 60% means 60% of the blood inside the ventricle is pushed out of the body per contraction. So this is how they evaluate heart function. Then they'll say, we'll take you to the Cath lab. The Cath lab is where they do the angiogram. Now, you might have heard the term angiogram and you might have heard the term angioplasty. And angiogram is when a nurse comes to your room and says, I'm going to shave you now. An angiogram is where they have a catheter that is put in either through an artery in your groin or an arterial artery here. They usually try here now because the recovery is faster. But if they can't get it in here, they will go in the groin area, which is why the nurse comes in and shaves you. So don't be afraid. She's done a lot of these, she's not looking. An angiogram is a diagnostic test, I think we figured that part out, that uses X-ray and dye. So when you go in there, they actually inject you with what they call contrast, which is dye, so that they're able to see your blood vessels on the screen. So X-rays and dye to find blocked or narrowed blood vessels. An angioplasty is a treatment procedure that uses a tiny balloon to open up those blockages and restore blood flow, often placing a metal mesh stent to keep the artery open. Now, can they do this during the angiogram? Yes, but only if there is a dangerous blockage that needs to be fixed right away. If it can wait a bit, that's when they will book an angioplasty to do it specifically with that purpose. A reminder, again, that I am not a doctor. I'm a patient. What I'm sharing with you is my experience and the things that I've had to learn along the way. There are lots of acronyms, and I know I didn't say this as we were going through STEMI and NSTEMI. MI is another very popular acronym, which stands for Myocardial Infarction, which is the proper name for a heart attack, or the name of a heart attack. So what I'm sharing is only my experience, and as we go along this series, I'm mostly going to focus on the tests and the diagnoses that I have received. So it would not apply necessarily to anyone who's had a heart attack. As a matter of fact, as we go on, it's going to be much more specific. What I shared in this video shows the basic tests that they would do if you're admitted for a heart attack. So I'm going to leave you with a question. I was going to try to bring up my report from my angiogram, but I can't find it right at the moment. An NSTEMI means there is a blockage, right? When they did my angiogram, they found that the blockage that I had was minimal. It was 30%, which is considered insignificant. So the 30% blockage that I have, because normally it's not, they don't do anything unless it's about 70%. So they're looking at 30% blockage, and that can't have given me a heart attack. So what do you think would have been the cause of my heart attack? And I know I didn't mention Takotsubo again. I will bring that up later, but just to know that was not my official diagnosis. So think about it. I was classified as an NSTEMI because the ECG was identifying a blockage, But when they looked at my arteries, they found that there really wasn't much of a blockage. So I will see you soon, and let me know if you're enjoying this series so far, and if there's anything you would like me to explain better or look more deeply for. So the sources that I used, one of them was I will put the full website in the description for where I first got the first explanation of the ECG wave, and the images that I got came from the Cleveland Clinic. So thank you, and I will see you soon.